Welcome to our episode. We are here today to talk about how to prevent yoga injuries. So, this is kind of a hot topic in the yoga world. At least I feel like I see this discussed out there in the yoga world quite a bit. And so, we just want to take a little time to hone in on the topic of how to think about yoga injuries in a yoga context. Are there proactive steps that we might want to consider taking in order to prevent yoga injuries? And just some inquiries along those lines. And we happen to be super lucky because my amazing co host for this podcast happens to be Travis Pollen, who happens to be a recognized expert in the field of injury prevention, like a recognized total expert. And he is super up to date on all the scientific literature on this topic. He did graduate research on injury prevention, and he actually just recently completed a masterclass for Physio Network, which is a research review service for physiotherapists, aka physical therapists, on the topic of injury prevention. So we have Travis here kind of fresh off that, and he's a total resource for us. He'll be sharing information and insights about injury prevention in a general sense, kind of from like the athletic and sports side of things, where a lot of research has been done on this topic. But then we will also take the insights that he shares and we'll make it more specific to our yoga lens today. So thanks so much for being here with me today, Travis.
Thank you for that really warm introduction. Expert is always a tough label to live up to, but I'll do what I can.
I know that that's how you feel, and I totally respect that. That's specifically why I said recognized expert. I don't know, just meaning that
So
other
I don't
people,
have to call myself an expert, but other people can, and that's
like
okay.
Physio Network can, and your
Fair
PhD
enough.
can, and yeah, but you don't have to call yourself that. Yes. So before we dive in too much into this topic, could you just tell us a little bit about your background in this field and how it is that you become so knowledgeable about injury prevention?
Yeah, so I guess it kind of goes back to my master's degree, which was in biomechanics. And so I studied amputee gait biomechanics, which doesn't really have anything to do with injury prevention in particular. But the skills that I acquired from a biomechanics standpoint then led me to my PhD, which was in rehabilitation sciences. And
Hmm.
in particular, human and applied biomechanics was kind of the lens that we took. And so my dissertation work was on risk factors for injury in competitive swimmers, which is sort of like the very early stages if you think of a conceptual framework for injury prevention, where like preventing injuries is kind of like the last step, but before that you have to figure out what's causing them, and before that you have to figure out what
Hmm.
the injuries actually are that are the problem within your context, whether it's sport or yoga or whatever. So again, my research was really looking at the risk factors that predispose athletes or swimmers to injury. And then just from studying that area, I broadened my lens to general athletic populations. And besides swimmers, another population that I have been interested in is athletes who are recovering from ACL injuries. So ACL is
Hmm.
anterior cruciate ligament,
In the knee.
and yep, of the knee. And that is an injury that often recurs, or once you have one, there's an increased risk of getting another one. So that is not just injury prevention, like preventing ACL injuries, but also re-injury prevention,
Hmm.
which is, of course, a related subdiscipline of injury prevention.
For
So
sure.
that's the two big areas that I've been interested in. Then within those, especially as it pertains to risk factors, there's a lot of interest in pre-participation screening, which
Hmm.
is in a sports context, can you identify risk factors ahead of time, like before an athlete gets injured, and try to predict who's going to get injured and then apply your intervention to those people. So that's an area that I've really dived quite deep into
That's
over
right.
the
You've done a
last few
lot on that.
years.
Yeah, and I'm sure we'll talk a little more in depth about that as we talk today. I hope that we get to that. Okay, great. Well, thanks so much for explaining a bit about your background. And one of my first questions for you would be just to kind of take a step back and ask if you could define injury for us, because I do believe it can be a bit of a complex topic, like what's an injury? And with pain science, and so many of us are learning more about pain science these days, we're also kind of learning that there can be a distinction between pain felt and an actual injury or tissue damage, things like that. So could you
Right.
define injury, at least within your
Yeah,
work?
and there was an excellent paper, and it was really more of an infographic from 2021. I will link it in the show notes, but they differentiated between these two things, and I realized this was only a couple of months later that maybe I was guilty of conflating the two terms in my own work. Um, and I think that's true a lot of times is
I
where
think a lot of people do that.
yeah, you're doing a research study and you're wanting to know how many injuries are occurring or what the risk factors are, and you can operationally define injury for whatever however you want to define it. And there are many definitions
Right.
that you can use, and this is one of the challenges when trying to synthesize research like with systematic reviews or meta-analyses where different studies have defined injury differently, and so it's hard
Hmm.
to put all of those studies together when you have different injury definitions. So, for example, the broadest definition would be any complaint, but then within those complaints, you have a subset that are seeking medical attention, and
Right.
so not all injury complaints actually seek medical attention from a doctor or an athletic trainer or a physical
Like they're not
therapist.
that significant enough, like
Yeah, well,
for
and
them to
it's
actually
like
go to
a
the doctor.
yes. So not every complaint gets brought to the level of a medical provider. So you get fewer injuries when you classify it that way. And
Hmm.
then even fewer if you're calling or if you're restricting your definition to time loss. So this is actually preventing you from participating in the activity or the sport, which we
Hmm.
know, like runners, for example, they'll train through or they'll continue running even if they have an
Right.
injury. And so if you just limit it to time loss injuries, then you're not capturing all of the potential injuries that matter. So,
Hmm.
and then you can go even more restrictive to severe injuries that are causing athletes to miss like a significant amount of time, whether it's 10 days or 3 weeks. Those are some of the cutoffs that I've seen. But basically the push nowadays is to not is to capture as much data as you can. So really all
Hmm.
those complaints, and then you can whittle it down after the fact. And a good way to do that is through like a weekly survey where you're
Hmm.
at. There's one called the Oslo Sports Trauma Research Questionnaire, something, or Oslo Sports Center, something like that. But it's by a researcher named Ben Clarson, and they ask people every week, have they had a health problem, which is like any sort of illness or injury or complaint that's affecting their participation, their performance, causing them pain, and then there's one other question, but basically trying to figure out what level of interference is this causing, and then maybe they'll also triangulate that data with data that they're getting from the medical team so that they're just capturing everything. So I forget what the point of the
Hmm.
question. Oh, the point of the question was, is there a difference between pain and injury? And so, like I said in my research, I was looking at swimmers, and I was particularly interested in whether what the risk factors were for interfering shoulder pain. So
Interfering meaning it's
pain
yeah,
that
sorry.
interfered with their ability to either train, practice, or
Hmm.
compete. And
Hmm.
so that I really should have called interfering shoulder pain, or it didn't. It wasn't necessarily shoulder pain. It was pain anywhere, but I really should have called that interfering pain. But I sort of said I defined injury as interfering pain, and if I could go back,
Hmm.
I would have just called it interfering pain because conflating these things is the problem, or
Right.
it can be problematic. So to summarize, you can have pain and you can have injury and you can have both. So you could have one or the other both. So you could have pain but not have like a structural injury. You could
Like
have
actual
you could
tissue
actually
damage.
you could have structural damage and not have pain,
Mm-hmm.
or you could have both. So it's useful and worthwhile to get clearer on what we mean by those
Mm-hmm.
things, and because there are ramifications when it comes to diagnosing, treating, recovering
Right.
from pain versus injury, or both.
And if we're wanting to look at injuries and, for example, like how common they are or how big of a problem injuries are within a certain sport or activity or like within yoga itself, it just seems to make sense that if we have a clear definition for what we mean by injury, that helps us kind of get a feel for it or assess. So, would you suggest that maybe a helpful, just loose, casual way that we and maybe our audience might think about injury in this context is some sort of complaint that results in the interference of their either participating in their sport or practicing yoga on the mat? With that, or
Yeah,
is that not complete enough, really?
no, I think that's that all complaints. So
Yeah,
it's
yeah,
a and the wording that researcher Ben Clarson uses is a health problem. So
right.
any complaint doesn't have
Oh,
to
yeah,
have caused you to go seek medical attention, or it's interfering with your ability to practice.
right. And calling considering like a health problem, that seems like extra broad, but I feel
It's
like our
extra broad because it's
interest
also including illnesses, and
exactly, which
that's tricky, and that's I find it a little problematic in the research, because when they use that questionnaire and they're including illness, um, it's like another can of worms.
seems
Like,
like gets
why?
a little confusing. So more like
Whoops.
musculoskeletal injuries slash tissue damage slash pain associated with that, as opposed to getting sick or something.
Yeah,
So,
yeah.
so
So
and for our purposes today in this conversation and with injury prevention and yoga, we're kind of thinking musculoskeletal injuries.
yeah, yeah. Whether yoga causes colds is uh,
Or if yoga
outside of my scope.
sleep buddy. Right. That's like not really, that's not so much what we're talking about. Okay. So with kind of this general casual notion of what we mean by injury when we're referring to that term today, there are different types of injuries, right? That maybe you could help us understand a bit more. Like there are acute injuries, there are overuse injuries, which I don't know if the correct term for that is like a chronic injury, because I know there's chronic pain versus acute
Gradual
pain.
onset is a new one that's getting used.
Mm.
There's a nice paper that we can link in the show notes. We'll link all the papers we mentioned in the show notes,
Yes,
but
totally will. Yeah.
by Roald Barr, it was a consensus statement from either 2021 or 2020, just defining like methods for injury surveillance, and so they give really good definitions for these different types of injury. But basically, you can boil it down into either acute injuries or not acute injuries. So an acute injury would be
Mm-hmm.
like there was a specific moment where something went pop, or it was like, oh,
Mm-hmm.
I wasn't injured and now I am injured.
Like an ACL
And
tear or an
yeah,
ankle sprain.
yep. And there was a clear, what we call an inciting event, where that moment you can say that's when I got injured. And
Mm-hmm.
then within those acute injuries, they can either occur through contact or non-contact. So contact would be like contact with another person, non-con or playing equipment. So you can have
Mm.
contact and then different types of contact, and then you can have non-contact. So there's those types of injuries, and then there are gradual onset injuries, which we might also call overuse injuries, where there's
Mm-hmm.
not, I know that I'm injured, but I don't know when I got
Mm-hmm.
injured, or it was just kind of it came on over time.
Yeah. And in a yoga context, just based on like what you know of yoga and what you know about types of injuries, would which would you say would be more? Could you even say which you think might be more?
Yeah,
Obviously not contact, unless
it's
well
got it.
maybe if there's a
Yeah,
yoga teacher. Yeah.
yeah, and even then, that's not like your typical like a contact mechanism is usually like a high speed, high velocity
Mm-hmm.
thing. Like what in
Mm-hmm.
the previous episode we talked about an injury that you sustained
Yes. With it
through,
from a teacher
yeah,
pushing me deeper into a seated straddle forward fold.
yeah. So that would, I suppose that would be a contact
I guess
injury.
it's
It's
contact, but
certainly
it doesn't
not,
seem the
yeah, it's
same.
certainly not non-contact, but yeah, I would say that we're not seeing a lot of contact injuries the
In
way
a
that we
yoke.
see them in contact and collision sports in yoga. So that leaves us, yes, there can be acute injuries. I did
Fall out of a
something,
handstand.
yeah, that, but whether I would probably say that the overuse mechanism or gradual onset is going to be more common than those acute injuries, but I don't know the numbers off the top of my
Right.
head.
I don't know the numbers either. I mean, this is all kind of just based on, I think, just a feeling or a sense of, because I don't know of any, well, actually there are studies on yoga injuries, but as far as like defining them between acute and overuse, it intuitively makes sense to me that yoga is kind of a maybe more on the endurance side. If you're talking about like classifying, it's kind of repetitive and people do it often.
Yeah, repetitive motion, I would say, because we're kind of repeating the same general poses.
And
It's
movements,
it's
right?
it's more predictable than team sports where that are very unpredictable.
Yeah, that totally makes sense. So that's helpful just for us in thinking about injuries and what types of injuries we might be thinking about if we're talking about the practice of yoga.
For sure.
And then when it comes to an injury, what causes injuries? And I know that's a very broad and general question, but can you tell us a little bit more about injury causes?
Yeah. So I think most of the time when you have that, especially when you have that acute type of injury where either you fell out of a handstand or you were in handstand and something felt weird in your wrist or your shoulder or whatever, we were quick to think, okay, the cause of the injury was the handstand. And we
Right.
forget that there were handstands before that handstand, but even beside from handstand itself, like we don't necessarily have to say that was the exact problem because there are a lot of things that happen way before that handstand um, that can cause or that can contribute to increased risk of injury. And so, like that, we're basically talking about risk factors. What risk factors are increasing your susceptibility or predisposing you to injury that is then occurring in that inciting event. So that would go back to things like age. So maybe if you're older, so that there, and we can separate the predisposing factors into things that are internal to you and your body and things that are external to your body or like environmental factors. So internal to you would be like age or sex or years experience with yoga. And then external factors would be like what style of yoga you're doing, what the temperature is in the room that you're working in, that you're practicing in. The yoga teacher would be an external factor,
Right. And like
especially
how they're
in your
teaching the
case, right?
class.
Yeah,
Right,
not
right.
only not only just they put their hands on you or not, but just how they're teaching the class, how they're communicating,
Yeah, how
what
they put the
they're
poses together, what the sequence is.
yep, all external factors. And so it's important to think about those factors that are within the person and outside the person leading up to this
Inciting
inciting
event.
event and not just the handstand. Oh well, and then the other part of that is it's not just that handstand, but it's what was your whole movement practice looking like that day, that week, that month? Did you go into handstand without having been prepared for handstand?
Right.
So, or were you fatigued in that moment, and that was contributing? So it's
Had
not
you not
just like
slept well, maybe? Had you not been sleeping well in general?
right. So your readiness or preparedness, or you could also think about stress, like hydration state. So there, it's more than just the handstand that when your shoulder went ouch, you want to be thinking about that really big, much bigger picture as opposed to vilifying that pose.
That actual pose. That makes so much sense. Something that you have taught quite a bit about, that I've observed and learned from you, is that injury is always multifactorial. And it's, or at least I believe that that's what you've taught before, that injuries can, they are multifactorial. Many different factors can interweave to influence whether or not someone experiences an injury. And so it's kind of easy to boil it down and look at just that one event that we want to label as the factor, but it's maybe
Right.
if you'd slept
And
better. Yeah.
yeah, and we know that alignment in yoga is the one that people tend to
Hmm.
go really, you know, just
Yeah.
obsess about. And yeah, that is certainly a factor. Like biomechanics can certainly play a role in the mechanism of injury and predisposing to injury. But there are so we just talked about there are so many, and there are so many other factors, and there are so many more than we just talked about
Yeah,
that
so many.
you want to make sure that you're not just focusing on one, which is actually nice because it can help when you start thinking about preventive measures. Okay, I
Hmm.
don't want to just put all my eggs in the alignment basket, but I can be making sure that I'm sleeping and that my practice is reasonable.
Hmm.
Like the amount of practice that I'm doing is reasonable, and I'm not doing too much too soon.
Right. I'm not practicing
Um,
every single day, like volume of yoga practice and frequency
yeah,
and
and like what
intensity.
are right, and what are my internal factors that might put me at increased risk? So I need to be more engaged in being mindful to mitigate those.
Right, 100%. Or how prepared am I to practice handstand? How much strength have I built over time? You mentioned earlier experience. So just how many handstands have you practiced in your life?
Yeah,
To have a sense of familiarity and control
and
there.
strength. I'm a little biased, but strength is a very protective factor. So
Hmm.
so there are risk
Right.
factors and there are protective factors. Decreased strength or low
Precisely.
strength would be a risk factor. Increased strength
Right.
would be a protective factor.
That totally makes. So I think this is really good. We're suggesting this and laying this out because it does seem that within the yoga world and in so many yoga teacher training programs that I'm familiar with that are teaching teachers and how to think about all of this, my strong impression is that yoga alignment and the way that we arrange our bodies and our poses is really held up and pulled out as the one factor that contributes to injury. And if a yoga student does have an injury, it's often blamed on you were practicing bad alignment. It's because you did that in a non-optimal way, or your alignment was bad. But I think it's important to appreciate that it's such a much bigger picture than that. And like you said, alignment can play a role. It doesn't always, but it can. But there are so many more things that go into whether someone has an injury. And I feel that most yoga teacher training programs I'm familiar with they just probably don't realize, but it's just really underappreciated the true complexity and multifactorial nature of injury.
Hmm.
So,
Yeah.
yeah.
So maybe we should talk more about why alignment is so heavily focused on and why maybe we don't have to worry as much about it.
Yeah, yeah, yeah.
So why are these yoga teacher trainings going so
Hmm.
into the weeds on that relative to injury prevention?
I think I think it has to do with seeing biomechanics and the way that like our joints and our bones are aligned in our poses. Just seeing that as so important. And I understand it's like if you consider an injury being tissue damage, then it makes sense that the way that the forces are moving through our tissues are can be affected by how we're aligning our like it just seems like maybe it's the most obvious factor and so maybe that's why it
Hmm.
gets pulled out. I think that's why. And just so much emphasis on, I think you're probably familiar with like the idea of joint stacking within our yoga poses. Like it's really important to align your body so that the forces travel through the bones rather than through soft tissue. So by joint stacking, you ensure that like the forces travel in a quote safer path. Think versus aligning in a like non-joint joint stack position. So that's often taught in yoga teacher trainings that say we're in plank pose or even hands and knees, like tabletop, something like that, that it's very important that the shoulder be vertically stacked directly over the wrist and not slightly forward or slightly back or slightly to the left or right, because then the force is traveling. If you're not joint stacked, the force is traveling at these oblique angles, and the belief is that we're more vulnerable there and more likely to injure. What do you think about the approach of joint stacking all the time?
Well, so to me, it probably goes back to like the tradition and the aesthetics of the shapes, right? Like the early traditions were that this is the way the poses were supposed to look, and so that maybe got that aesthetic goal maybe got wrapped up in
Yes.
now we're realizing that injuries are important and injury prevention is important, and so the way that we think that the best way to go about that is through trying to practice the shapes in that very idealized manner. Do you think
Like these
that?
straight lines, vertical lines, and 90-degree angles, like just these kind of
Yeah, but the
yeah,
truth is that like
ideals.
those are more aesthetic ideals than they necessarily are uh,
Hmm. What would you
targets
like?
for injury risk reduction. Just because
Right.
we know how different everybody's anatomy is, which is going to necessitate that they look different, and so actually maybe trying to fit those ideal
Hmm.
targets might be you might be worse off,
Counterproductive.
yeah, than doing it the way that feels right for you. But
Such a
going
great
back
point.
to like the joint stacking thing, um, I think that the part that gets lost in that, and this is especially what I found with my research. So it's true with swimming too. We think that there are certain ideals that the stroke should look like. I
Hmm.
was interested particularly in whether quote unquote errors in freestyle or front crawl stroke mechanics predisposed or increased an athlete's risk of injury.
Hmm.
And so what I found was that they didn't. But for the most part, there was maybe one that did. But um, it's surprising
That's so
because
counterintuitive for a lot of people,
yeah,
I would
we
think.
would think like, oh, if you're doing something funky with your shoulder and you're putting yourself in that strange position thousands of times over and over in the course of a training session and over the week and over the month and over the year, like that has to matter, right? But what the counter argument to that would be, well, these people have been doing this for 10 or
Exactly.
12 years, and have adapted to their whatever funky positions that they're putting themselves in.
Right.
So maybe it's more about building up to those positions than it
Hmm.
is about a right versus a wrong. And I actually had a swimming coach named Charlie Kennedy, and he said that, and I think this would apply to yoga too. He said swimming is stroke technique is like handwriting. Everybody has a different style,
Oh,
and
oh,
it's
I like
not like
that.
one person's is right or wrong. It just everybody, what's optimal for each person's going to be different. It's all
Wow.
still writing. Like
You still could
it's you.
recognize it as like a
Yeah, you still
letter
know that a
and a
down dog is
word.
a down dog because it looks
Yeah.
close enough to a down dog and not
Plank
like
or I don't know,
yeah,
something.
yeah, bow pose or whatever.
Mm-hmm.
But yeah, so
I like that a lot.
it's about the individual variation. It's about the relative preparedness. Um, and I think we see that in running too. I'm not as familiar
Mm-hmm.
with the running literature, but there have been a lot of positions, heel striking, and
Right.
pelvic alignment, pelvic drop, foot pronation, where
Like people
it
pull those
seems
out and they
like
want to say that they're risk factors for injury.
yeah, and
But
like it's mixed. The research is so contradictory. Like some studies do show those things, and some studies don't. So
mm-hmm.
again, it's not to say that nothing matters and you can
Mm-hmm.
do anything that you want. But the what's especially true in yoga is that it's a body weight movement practice, right?
Exactly.
So um,
Meaning relatively low load.
yeah, and relatively low velocity. You're not typically
Mm-hmm.
moving very quickly between poses, and there are some more faster, more powerful transitions. But um, as a
But on the
whole,
whole,
it's
it's very
like,
slow and controlled. And like the types of
yeah,
injuries that you study and like talked all about in your master class on injury prevention, they seem like those injuries mostly, or I guess really the acute ones, but they seem to happen from high impact, high velocity. Like these are fast movements with a lot of force involved that seem like risky. But in yoga, it's just so slow and controlled, and we don't have super heavy weights on us that we're
yeah.
moving around, and we're not colliding with other bodies.
Even even in the sports stuff, like there has been a big push over the last few years to look at vertical drop jump and
Oh
risk of
yeah.
ACL injury. So that's a test where you step off of a plyometric box, so like a heightened object, and then you immediately go into a vertical jump. And so there was some early research that found that if you had more knee valgus during the transition from the landing to the jump, then you were more likely to sustain an ACL injury.
And knee valgus is
Knee
when the knee drops
valgus
in.
is like, yeah, knock knee position,
Mm-hmm.
internal rotation, adduction, and uh, what's the other one? Pronation of the
Yeah, I was going to say
foot.
foot pronation.
Okay, yeah,
Yeah, I feel
so
like
it's
it's three things. Are those
that
the three?
trifecta. I think those are the
Yeah,
three things.
internal rotation, adduction, pronation.
Yeah.
It
So
might come to one of
anyway,
us. Yeah.
I think that's it. So anyway, they're like over the last few years, much bigger studies have been conducted analyzing that
Mm-hmm.
vertical drop jump in a million different ways on hundreds of athletes, and they just have not found that supposed fault
Like
or
error or
misalignment or error
right.
or whatever you want to call it, movement dysfunction.
Mm-hmm. Mm-hmm.
Dun dun dun. That they just haven't found that actually increases the risk of injury in these
Right.
large scale studies. So, which is frustrating because on the one hand, like we thought that was a good test that we could use to identify risk of injury, and at least in the handball and I forget what volleyball players maybe that study looked at, or those studies have looked at, they just haven't found that. So yeah,
Mm-hmm.
there's certainly some literature that suggests if you move quote unquote suboptimally,
Wrong.
you
Mm-hmm.
have an increased risk of injury. It's hard to say whether that would be true in yoga. Like I don't know that those. I'm
Right.
not familiar with those studies if they do exist, but I would be surprised if they do.
If moving in quote bad alignment in yoga predisposes people to injury, even though you
Hmm.
hear that all the time, and maybe it makes some sort of common sense on like a superficial level, but when you I think that you asked the question of why do yoga teacher trainings focus so much on alignment is so important for injury prevention. And something that I realized also in hearing you talk just now is that I think something that's overlooked often in the dialogue around this is simply the adaptability of the human body and the fact that both the soft tissues of our body, but also our bones, all of that, they adapt when loaded and they remodel in response to load in order to become stronger to continue to withstand those loads because our body seemingly seems to just like to it's sensing what and how you're moving your body and then it's continually adapting to help you continue to do that. So I think it's just like if you're traditionally yoga might be taught like warrior two pose might be taught in that joint stacked manner with that front knee directly over the ankle, and that's often emphasized as very important so that you don't injure the knee. But I think what we know from this like broader context and understanding about the adaptability of our tissues is if someone were to practice warrior two with their knee in a little bit, but on a regular basis over time, and that's how they did warrior two for however long, months or something, that you would think their tissues would just adapt to continue to withstand those loads so that that quote unquote bad alignment, it's not necessarily inherently bad. It just seems like injury seems to be more a question of how prepared are you and how adapted are you for the movement that you're doing in that one snapshot of time. So it's more
Hmm.
about movement preparedness than it is about
Right.
like one alignment being right or wrong.
Yeah. So if you suddenly, without ever having done yoga, go
Mm-hmm.
into 6 days a week of practice with that inward caving knee in your warrior
Warrior
one,
two. or
or
either
Warrior
warrior,
Two.
really.
Yeah, either Warrior or
Either
Warrior
one.
Two, or Warrior Three. Um,
Right. All the
maybe that's a thing,
warriors.
but also like maybe as long as you're strong, then that's
Hmm.
fine. And so
Right.
that's
That's the other thing,
something.
right?
There's this area of literature that looks at cutting mechanics. So in
And what's
sport, that would be
cutting?
like where you're running linearly like ahead, and then you quickly sidestep to either like 90 degrees or 45 degrees. And so there's this thing that they call the performance injury trade-off, where there are certain techniques that allow you to cut faster. And one of them
Hmm.
is that knock knee position of the
Oh,
plant leg. And so that is that's favorable from an athletic standpoint, but it might also increase risk of knee injury.
hmm.
So how do you reconcile those two things? Where on
Right.
the one hand, you don't want to slow athletes down or be training them in a way that's going to be counterproductive for their performance, but also you want to keep athletes safe. And so the argument or the recommendation would be, okay, well, we're just going to get athletes really strong so that they can tolerate those
Right.
positions,
Yeah.
so that they continue to do them in the way that's going to help their performance, but hopefully with a reduced risk of injury.
Well, that makes sense. So that's kind of maybe that's the strategy that they've settled on is the trade-off isn't as much of an issue if they simply focus on strength. Then they can have both. Like they can be safe in those transitions and their performance can be enhanced by using those cutting techniques. But because they're stronger, it's probably safer.
That's the thinking.
Can you tell us a little bit or elaborate a little bit on the connection between strengthening the body and strength training and potential injury risk reduction? Like how strengthening
So,
can result in that?
well, at the most basic level, the injury is occurring when the biomechanical stress exceeds the tissue's capacity, right? So if
Mm-hmm.
you work within your tissue's current capacity, kind of at your edge from a loading standpoint or from a frequency standpoint, then you can push that. It's called the envelope of function, but you can push
Mm-hmm.
that envelope farther so that your ability to withstand like external stress is higher. You can with sustain, or you can handle more load and or more
Mm-hmm.
frequency before you experience that tissue damage. So the idea is that through strength training, we increase the capacities of our tissues to tolerate load and produce load.
Right. So through strength training, we increase our muscles' ability to produce force. So we get stronger, like we can lift heavier weights. But at the same time, we also make our tissues more resilient in general. So like we can produce more force, but we can also withstand more force.
Mm-hmm.
So our muscles, but also our soft connective tissues like our ligaments and tendons and things, they can just their capacity to absorb load has increased.
Mm-hmm.
So that potentially you could think about having two people side by side in a yoga class or in an athletic activity, and maybe they're both doing the exact same movement at the same time. But if one of them just happens to have stronger tissues, depending on how high the loads and forces are involved in that movement, but the person with the stronger tissues that have higher capacity, they're more likely to resist potential injury than someone who has weaker
Yeah, and
tissues.
that's why what makes it hard to just look at somebody and know for sure that that person is at risk of injury because they're doing it that way. It's like, well, you don't know their training
Exactly.
history. You don't know what else. You don't know how strong they are. You don't know what else they're doing. Besides
Hmm.
that, you
Right.
don't
That's why
know
it's
anything. You hardly know anything just from looking at them besides how they look. So it's really it's bad for bad form to look at somebody and say that their form is bad.
right, and that's going to cause them injury. Or if they keep practicing the pose that way, it will cause them injury because they're just looking at one snap, like one factor, when really there are so
Mhm.
many factors that go into it. That makes a lot of
Exactly.
sense. Earlier in the beginning of our conversation, you mentioned pre-participation screening, which I feel like is
Hmm.
really kind of wrapped up in all of this. But in like an athletic context, there are certain like tests or screens that people will be run through, like their movements will be tested or assessed. And if they're deemed to be suboptimal, or like in the yoga world, we might think of that as bad alignment, something like that, then those people are considered at higher risk of, they're often considered at higher risk of injury. But
Hmm.
you, through your work, you've looked in depth at research on screens. Like one really popular one that I think quite a few people in the yoga world are familiar with is the FMS, or the functional movement screen. That seems like a pretty widely adopted one. And I know
Hmm.
that you've looked at that in depth. Has your research helped you see that these screens are valid for injury prevention purposes?
So it's a can of worms because oftentimes what we'll see with those studies is an increased risk of injury. So athletes who perform poorly on some of those tests may be at increased risk of injury.
Mm-hmm.
Like maybe the headline for the research study would say like athletes who performed poorly on the functional movement screen were 2.7 times more likely to get injured than athletes who performed well, and that performed poorly versus performed well is kind of like an arbitrary threshold
Right, like where do
where,
you draw the line?
yeah, because the scoring for most of these things is like with the FMS it's a 21 point scale, but it's typically a what we call in statistics like a continuous data type of data
Mm.
where it,
Mm-hmm.
0, 1, 2, 3, 4, 5, 6, 7. Okay, well, what's good and what's bad, and there are statistical techniques for trying to identify that cutoff. So when you do get that increased risk, um, the thinking is okay. Well, now we can stratify our injury prevention efforts, and we'll just give the injury prevention program to the people who we deemed high risk based on our pre participation screen. And what inevitably happens, this is like a really age old injury epidemiology problem where you have more injuries occurring in the low risk group than the high risk group, just because there are a lot of people in the low risk group. So
Right. There's just more people,
even
sheer amount of people.
yeah, just you have this small high risk group. Yeah, the percent or the proportion of people will be greater that who get injured in the high risk group compared to the low risk group, but the absolute number of people who get injured will likely be bigger in the low risk
Low
group
risk group.
just because there are so many people in the low risk group. So anyway, this favors the idea of not using risk stratification because you're going to be missing out on those
Mm-hmm.
people who you deemed low risk who get injured, and so this is like statistically this is the difference between an association and prediction, because if you were able
Mm-hmm.
to nearly perfectly predict with like 90% accuracy the people who were going to get injured, yeah, then you could just apply the intervention to those people, because you're getting almost nine. You're getting ideally 9 out of 10 of the people who get injured. But when
Mm-hmm.
you are intervening on a high risk group and then all these other people are getting injured, that favors what we
Mm-hmm.
call a more global approach. So, like nowadays, in the age of pandemics, we might call this a vaccine, where we're not just giving
Mm-hmm.
the intervention to the high risk group, we're giving the intervention to everybody. It's a global or a mass prevention approach, because we're just
Mm-hmm.
trying to get everybody. Trying to, if you imagine like a bell shaped curve of performances on a screening test or risk, we're trying to shift everybody towards higher performance or lower risk.
On a global level.
Hmm.
Yeah. That makes a lot of sense. So a global approach would just be to give everybody injury prevention, in general, just to like
Right.
help like protect
So,
everybody.
so the way to think about it would be, instead of trying to identify high risk individuals, just treat everyone as being high risk simply
Yeah.
because they're engaging in the activity.
Right. Because the activity involves some level of risk itself. That makes sense. Yeah. Yeah. So in summary, if you were to step back and look at something like these movement screens or something like the FMS, I know you've talked before about how you still see them as having value, but just maybe not for the purposes of predicting injury.
Yeah, we are not at the point in 2022 that we're able to predict who's going to get injured from pre-participation screening. And so that tells us a few things. It tells us that we shouldn't try to use those pre-participation screens to predict injury.
Hmm.
We can use measurement of athletes for other reasons, and in a sports
Right.
context, the biggest reason is what I mentioned way back at the beginning of the episode, where maybe you're able to identify athletes who currently have some minor complaints by
Hmm.
measuring them in this moment. So instead of trying to predict who's going to get injured, let's just identify the people who are already injured or in
Right.
pain.
That totally makes sense. So using like these screens as like constant monitoring over time or continual monitoring over time rather than just this one snapshot, one time. Because we're always evolving and as we said, our bodies are always adapting based on what we do. So one movement screen or test one time, it could be a little far removed from telling us much about someone once it's like a few months down the line, like if they were to do it again,
Yeah,
it might come out
that
differently.
absolutely a few months down the line, and even some things change on like a day-to-day basis.
Right. Right. Yeah, so I feel like I've learned from you about because I just know I personally used to hear a lot about the FMS and like it's very revered as like this tool that really helps people identify who is going to get injured. And I know it's a very structured system and it's not used in a yoga asana or yoga class context, at least not in my experience. But in my mind, I kind of liken something like this movement quality assessment of the FMS or similar screens. I liken them to the way that alignment and movement is often talked about in the yoga world in a less structured way, but more just like if someone can embody Warrior 2 in this, what we deem as to be good movement quality way, then like they're safe. And if they
Yeah,
don't,
it's the prerequisite thing. So uh,
yes.
if you in the functional movement screen world, and maybe this is a misapplication, but I'm not so sure. Like they would say, if you can't do an active straight leg raise where you're lying on your back and flexing one leg,
Mm-hmm.
if you can't get it to like 70 degrees of flexion, then you shouldn't deadlift. And it's like,
Oh, that's a
well,
rule.
maybe it is, maybe it isn't. It's some people treat that as a rule, and
Mm-hmm.
maybe that's not what's coming from the horse's mouth. But if you're putting these kind of arbitrary rules on
Mm-hmm.
things, and that's an especially funky one because you're lying on your back assessing hip
Right.
mobility, and then you're telling somebody that they can't deadlift. That's a totally
It's a
different
totally different movement,
exercise.
right?
Yeah.
Yeah,
So maybe
it's
like, well,
totally different.
if you can't do a push up in the FMS test, then okay, maybe you shouldn't be doing push ups. But also that's
Right.
not really the case either. And I don't think they would say it is, but like you can do an incline push up, you can do a push up on the wall.
A
So
different variation,
it's more
yeah.
about finding. It should be more about finding what the appropriate starting point is for someone than
Right.
disqualifying or qualifying movements.
Ugh, I like that
And
distinction.
so yeah, the functional movement screen is this systematic approach to doing that. And in a yoga class setting, the teacher doesn't have their pencil and paper out,
Mm-mm.
rating people
Yeah,
on a
they're not
0 through
scoring
3
people,
scale.
no.
Yeah,
But it's
but
just a
it's
similar
a similar
overlapping.
paradigm of,
Mm-hmm.
okay, I'm trying to see how well they move, and I'm gonna
Mm-hmm.
use that information to potentially tell them to avoid or not avoid a pose.
So that's why I thought it was helpful to talk about the FMS, just because, yeah, it's not used, that specific test is not used in a yoga context, but just similar attitudes and approaches to these ideas of how
Yeah,
movements
it's
look and
like in any time you're in a group setting, it's very difficult to
mm-hmm.
engage in any sort of screening, and maybe you don't have
Totally.
to because you can just, like I said,
Yeah,
give
teach
everyone
integrated.
intervention or teach in a way that is gonna
You're so
cater to
right.
the average person or the common denominator in the room.
With
Um,
graded options, like teaching different
yeah,
options for people to. if you can do this, then maybe you can try this. And, just teaching people how to sense their own body and where they are so they can make their own empowered decisions about which variation of a pose to take might be the right fit for their body. Something like
Mm-hmm.
that. Yeah. So I know we're kind of heading toward the end of our conversation here, but in just heading toward wrapping up, how could we or how could you summarize for us how we might think about preventing injuries within a yoga context? Kind of like taking everything that we've said into consideration.
Mm-hmm.
Are there some things we should be thinking about to like
I
protect
think
us
the
from?
big thing is to avoid single factor thinking and
I
instead
love that.
take a like kitchen sink approach, which
Mm-hmm.
is going to consist of doing. But my bias is to do strength training,
Yeah,
like
mine too.
engage in strength training, and we talked about that in the last episode, right? Maybe that for you that is on the mat, because that's what
Right.
you're willing to do, and so in that case, like great, you can do it all right within the context of yoga, but maybe that amounts to a separate strength practice from your yoga practice. Another
Mm-hmm.
thing to think about is not going from 0 to 60, like
Yeah.
no yoga for just starting yoga and going like all
Straight
out 6 days a
into.
week, 2 hours a day, Ashtanga
Mm-hmm.
practice, but a more graded approach.
Giving your body time
Um,
to adapt and become familiar and yeah,
mhm.
for these
And
loads
also
to.
giving yourself the opportunity. So that's like big picture, giving yourself a time to recover in between
Yes.
bouts. So if you're feeling particularly fatigued or sore, like check in with your body, and maybe don't go do that vigorous practice again. Or if you're feeling an injury coming on, like
Mm-hmm.
either get that checked out or maybe do something different until that resolves. We don't need to be like, um,
Hyper.
yeah, we don't need to be hyper vigilant about it, but within reason. And
Mm-hmm.
then making sure, like off the mat, what are your stress levels,
Yeah.
factoring that in
How are
terms
you
of it's not
sleeping?
just the physical stress, but also the psychological stress can increase risk of
Yeah.
injury. So, which yoga is great because maybe yoga can be helping with that
Mm-hmm.
aspect.
Helping us
Um,
manage stress better.
yeah, which the research clearly shows that how we manage and respond to stressful situations is plays a role in the occurrence of injury.
Right.
And
Right.
then, like you said, sleep factors into recovery, nutrition factors into recovery, and then also just like this is like the common sense, but like when you are practicing yoga, make sure that you're in an open space with like plenty of room, um, so that you don't have any of those like catastrophic injuries
Yeah.
or like
Like just
things
simple
that
safety in the.
shouldn't happen. Yeah, common sense safety practices
Yeah.
of like making sure that your mat is not going to slip. Like I was an idiot the other day, so I was taking a class in your online yoga library.
You were
My favorite one. Well, I this was like a couple of weeks ago, but
the
I was
backbends one.
doing the whole body back bend flow. I think it's called, right.
That's so
And
fun.
the mat that I was using
Oh
was
no,
not.
slippery.
Yeah, it just wasn't.
Oh.
The surface that I was on was no good. So I went into my wheel and like my hands came together a little bit, and it
Mm-hmm.
was fine. I came right back down.
Right, but you
But
could
that
tell like
was
that was a little risky position
yeah,
for your
yeah,
body.
yeah.
No, it's a
So
good, yeah. The
that's
surface that
that
you're
that goes back to those environmental
external.
or external factors, but also like referring back to the experience that you had with that Ashtanga
Mm-hmm.
teacher, what's the context within which you're practicing, and what's the teacher's
Mm-hmm.
communication style, um, teaching
Yeah.
style, and is that a safe?
Yeah.
Are they creating a safe environment for you to practice
Yeah.
in, or not.
If there are physical adjustments and assists offered, if there are in your yoga class context, then are they being done in a way that, yeah,
Yeah, and
that's
it's not only the physical, but it's also the how are they leading you through the class,
there's that too, yeah.
and also are you feeling like a sense of competitiveness with other people in the room to
Mm-hmm.
embody a
Great
pose or
point.
go deeper? Is there pressure on you, either
Does that what
in
sort of
that you're internally putting on yourself or externally, or like beholden to something that you see on social media, like, oh, I aspire to that, when
mm-hmm.
that's not realistic for you. So those are like there are many external things that can be affecting the
Yeah,
way that we're practicing.
for sure. That can increase or decrease injury risk. And those are all really good points. So it sounds to me like you're suggesting, I love how you just your answer right away was just avoid single factor thinking. And so maybe that's kind of the main takeaway here is just to recognize and appreciate the true multifactorial nature of injuries and how many different things can go into and contribute to an injury or not. And many of those factors we can control and change, and some we can't. And just, you know,
Yeah, so you can't change that you are older and that maybe
yes.
that is a risk factor for injury. So that means that maybe you have to be even more mindful of managing the factors that you can control.
Right. Or you can't change that in this moment you can't change the fact that you're, say, more relatively weak or more relatively strong, like because you just have a certain strength level. But you could realize I have the room to strengthen my body more and make myself more resilient, and then proactively take on a strength training practice over time. Something like that seems like that would be very proactive for preventing injury.
Yeah, we have a great option for that.
Which we do. Exactly. Which we'll link in the show notes. But yeah, our Strength for Yoga remote group training and the book that we wrote, Strength Training for Yoga. We have a book and an ongoing interactive remote group training program and platform that is specifically for yogis to learn how to strength train and bring more balance to their movement practice and support their yoga practice and just the health and health of their tissues and their body in general. And
The
yeah,
other thing that I think is an interesting thing, and then we can wrap up, like
yeah,
strength training. Yes, strength training done well with appropriate dosage and intensity does make you stronger, but there are also sometimes interventions where strength training that hasn't been that, like, they didn't do it right and the people didn't
mm-hmm,
get stronger, yet there was
mm-hmm,
still a preventive effect or a protective effect. And
right,
so
right.
there
That's
are
so
other
true.
things going on, or the goal was
That's so
to
true.
modify somebody's mechanics, and the mechanics didn't change, but they still had fewer injuries. So
Yep.
maybe there's like the psychosocial aspect, like increased self-efficacy or increased
Yes.
confidence, or
Or
I don't know
trust in your
what.
body. Right.
Yeah,
It's yeah. It seems a
but
little could
it's
be
not just
mysterious.
okay. Yeah, you did this strength training intervention, you got stronger, therefore you
Right.
reduced your risk of injury. There are all these other benefits of strength training that somehow,
Can also, yeah, translate
yeah,
into that. It's so true. It's easy to think about it as just like in our minds, we picture our tissues got stronger. That can be a part of it, but strength training is, as injury is multifactorial, strength training has
yeah.
multifactorial influences on the
Which isn't
body.
to say that you should strength train and not get stronger, and that
Yeah.
shouldn't be the goal. The goal should be to strength train with sufficient intensity and volume to get stronger. Um, but it's weird, and it seems like that isn't
Hmm.
always necessary to
That's right.
have the
To
effect that you
appreciate
want.
the like bigger picture that strength training can actually, these other effects it can have beyond maybe what we realize, which makes it even so much more, even more cool, I think. So yeah, strength for yoga, that's our thing. And anyone who's interested in that, they should check it out. Yeah, we'll have the link in the show notes. So Travis, thank you so much for having this conversation with me today. I think the topic of
Thank you.
yoga injury prevention is an important one, and it's one that a lot of people talk about out there. And I hope that I know that we have offered some good concrete tips and maybe some good ways of thinking about this topic that are like research and science based.
Yeah, I'm like trying to really emphasize to the world the difference between association and prediction. So the more opportunities that I have to explain that statistical nuance, because it does matter when it comes to this stuff, I appreciate.
Yes, absolutely. Thank you for speaking to that in our conversation today. Yeah, that's a good topic that I've been wanting to get more clear about. So thank you. I think it's an important message. So thanks, Travis.
Thanks, Jenni.